This video is going to demonstrate some lower leg stretching while you're laying on your back. So you can have a pillow, or you can just not have a pillow. It's totally fine. On your back here, we're going to be stretching our hips out. We're going to be doing a hamstring stretch and some TFL and Piriformis stretching. So you're going to bring one of your ankles on top of your opposite knee. From here, we're actually going to be looking for a stretch through this part of the hip over here. I'm going to bring this foot in as far as I can, and then I'm going to take this hand and I'm going to give a little bit of a push down and away. So this stretch for me, actually, I don't feel it a lot. I'm pretty flexible in this position. I would probably do this actually in sitting, which I'll show you at the end here. You just want to make sure when you're pushing this leg down, sometimes your opposite side hip wants to pop up. Like I'll be like, oh, look at how far my leg goes, and then my opposite hip just like comes up. So basically what it would look like is it would do this sort of thing. So I'm not really getting a stretch through here. I'm just really crunching up in this area. So you want to keep those hips level as you go into stretching that. And actually that looks good for me. So I have my ankle on that knee. I'm upright as much as I can be. So I'm not just in this position, I'm upright. And then I'm just staying there, giving a little bit of a push down with my hand here. It's really, I'm just like laying my hand on. If I want more of a stretch, instead of pushing more, I would just lean forward just a little bit, and I can feel a really nice stretch in through this hip. Very similar to somewhat similar to a pigeon pose stretch. So that's getting the TFL outside of the hip joint there. You would want to hold that for about 30 seconds, take a break, and you can do another 30 seconds. I usually tell people try to ease into it like a 4 out of 10 stretch, so it's not huge at first, and after about 10-15 seconds of just letting yourself breathe, you can see if you can push a little bit farther. Just keep that ankle on that knee. You're going to take your opposite hand, and now you're going to be bringing that same knee across your body towards your opposite shoulder. And I am definitely tight in this muscle. I can feel a pull stretch in my what's called the piriformis muscle back here. This guy can be a big bugger sometimes postpartum or with sciatica because that nerve runs right underneath there. So this one's usually a big stretch that we'll feel. So as we're bringing that knee up and across, I'm mostly feeling that through here. I can stay with this. If you want to, at the end, after about 30 seconds, you can kind of let yourself drop down completely, but now it's going to be more of like a low back stretch. So only if that feels comfortable for you, but really focusing on bringing that knee up. If you feel a lot of pinching in your hip, it's probably up a little bit too far, but you can play around with that angle a little bit. Like right now, this feels like a lot of pinching in my hip, but if I bring it across a little bit more and down a little bit more, I get way less pinching, and I can get that pull stretch through the backside of my hip. So if I was sitting, what that would look like is instead of pushing away, I would be bringing that knee up towards my opposite shoulder, and I can even twist towards that that side. So I'm kind of like pulling a little and turning, and I can feel that stretch through here. The biggest thing too I want you to remember is that you're not just letting yourself slouch. You're coming up, you're sitting on those sit bones, and then giving yourself that stretch. And again, holding for about 30 seconds, and then taking a break. You can do the other side and doing 2 sets of 30 seconds. Another stretch that I like to do, have patients do laying on their back here, is a hamstring stretch. And we're actually going to do what's called an active hamstring stretch. It's also a little bit of a sciatic nerve glide. It's really nice to get those nerves moving and gliding. So you can leave this one straight, this opposite leg straight if you'd like. If that feels like too much on your back, you can simply keep the leg bent. If the leg's straight, you're going to get a little bit more of a stretch. So we're calling this an active hamstring stretch because I'm actually not really holding the stretch. I'm just keeping moving. So I have my hip in this 90 position here. So I'm not too far up, but right about there I can hold on. I'm keeping my shoulders relaxed as much as I can. And then from here, I'm going to keep my ankle in what's called plantar flexion. So I'm not pulling my foot up a ton right now. I'm just kind of relaxed. I'm not totally pointing it away. I'm just relaxed foot. So it's relatively plantar flex, excuse me. So as I straighten out my leg, I'm waiting to get that pull. I'm like getting a shake. I actually feel this a little bit in my calf, but in that calf hamstring area, backside of the body, and then just letting that leg come back down. So you can hold it up there for a couple seconds if you'd like. You can tell I'm not stressing my body a ton. I am getting a little shaky. And I'm just going through these. This is a sciatic nerve glide technically, or tensioner slightly. And I'm also stretching out my hamstring muscle. The hamstring muscle is the one that attaches to our sit bone and comes all the way down and attaches to the tibia bone down here. So these can get tight, lots of reasons why, but they're really nice to get moving in the morning. If I did want to add a little bit more tension onto this, then I could straighten out that leg and bring down my toes a little bit. I'll get a little bit more of a stretch in my calf. And I just go back and forth with that one. And I could do about 10 to 15 of these. This feels really good. Sometimes after this, the leg can feel really heavy. Whenever nerves get a little bit glided, they can be like, whoa, tired now. And that's totally normal. And then I'll show you on the other side. So I had my leg straight, but I'm just going to show you what it looks like bent. I'm holding on, my hips at 90-90, shoulders are relaxed, straightening out that leg, and then just coming back down. And I could do where I'm holding it for a little bit, get that nice pull, not totally straining. I can add a little bit more by dorsiflexing. That's a big stretch for me. I can go back and forth with that one if it feels okay and comfortable. So when I bring my toe down, I feel a tug actually at my sit bone a little bit. So that's just the nerve kind of getting pulled around a little bit there. So that's an active hamstring stretch, and we also added in a little bit of sciatic nerve glides there. If you wanted to stretch hamstring in sitting, best way is going to be with your foot. You actually won't see my foot here. You're going to be one leg bent. Let's see if I can change this a little bit. So you're going to have one leg bent, opposite leg you're going to straighten. That didn't help much. Let's try over here. Okay, so one leg bent, one leg straight. Your ankle is relaxed as much as you can. So it's kind of looking like this again. Now from here, I'm coming up as much as I can and bending forward. So now I'm getting a pull or a stretch through my thigh here. And I'm just this is more of a passive hamstring stretch. If I wanted to, I could do some of these while I'm sitting, but I'm trying to, again, maintain that posture as much as I can. So that would be more of an active hamstring stretch.